Welcome to the By Design radio program. My name is Dr. James Proodian of Proodian Healthcare and ProodianHealthcare.com, where health literacy is the key to longevity. And as long as God has us on this side of eternity, my show is designed to help educate you and your families to feel better, function better, and live as many quality disease-free years as possible. Well, I hope everybody is enjoying their summer with the weather and beaches and fun and vacation and a lot of safety and enjoying your time with your children and your families. I know my 5 children are home from school and having a good time with the beach and such. And, I think our decisions that we're making every day, as I've shared with you, from the triad of health, the physical, the nutritional, and the psychological, and following God's design and His plan is what this show is all about. As great as technology might be with iPads and a whole bunch of various devices that we see everybody using these days, God's plan and the way we're supposed to eat, the way we're supposed to think and process information, our emotional health, our spiritual health, our relationship health, along with our physical health, all are tied into His plan. For Luke 1:37, for with God nothing is impossible. That is the staple of the show. For with God nothing is impossible. So the ability to impact your health by making changes, and the changes based upon a physical, nutritional, and psychological plan is what we've been going through and outlining. And hopefully you've enjoyed the programs where so far we've taken the pyramid of health. And remember, if you need any of the information that I'm speaking on, please contact me at ProodianHealthcare.com. You could submit questions directly to me, and I'll be happy to share with you, for instance, the pyramid of health. The pyramid of health, when you go through tandemradio.com and you look through the archive shows, we've done detoxification, we've done digestion, structural integrity, nutrition from an inflammation perspective. We've outlined various core foundational principles of the show. We still have fatigue to do that will be coming, and right now we're just staying topical. In the last show, we were continuing with the conversation on structural integrity. We talked about reconditioning, and we left off with basal metabolic rate, understanding BMR, basal metabolic rate, how to influence, how to make it better. Remember, that's our furnace. We want to have really high BMRs. That's how many calories we're burning at 24 hours of rest. So we've laid on a couch for a whole day, 24 hours. It's how many calories your body would utilize during that time. So our BMR, which should be something that we don't want sluggish because we want to be churning and burning calories. We want highly efficient bodies, is a byproduct of having a healthy physical, nutritional, and psychological life. So as we look through and we continue our conversation today, we're going to be asking ourselves, well, what do we do? Like what this BMR that I've been speaking to you about, if you were listening to last week's show, and again, we're going to be continuing today with more of an exercise perspective. Do we go join a gym? Is that really the most logical thing to do if we want to, quote unquote, get into shape? We want to go and, every January people spend, memberships and they go join gyms. 90% of people who join gyms don't go. So you think about it, 10% of people who join gyms actually go. What ends up happening in an office like mine, Natural Healthcare Center, every February, March, my office swells with people looking to get out of their gym memberships. Why? Because they've hurt themselves. They've lost momentum, they're sore, they don't like it. And, there's a logical progression in medicine and in healthcare that should be followed, particularly for deconditioned people. We were talking last week about how our bodies can become deconditioned. Now, deconditioned is not just as simple as saying, I'm overweight and I'm a couch potato. Deconditioning is a science. It's looking at a person's motion patterns. So, for instance, I shared with you, as we did structural integrity, some of the things we should be able to do, like bend over and touch our toes, how to do a squat, how to do a lunge, various functional testing. So we're looking at it from a functional perspective. How functional are we? Yes, does a person have pain? Is the pain local? Is it radiating? But then really taking a look at a deconditioned person through their blood analysis. And by the way, all of your blood values could be normal, but I might read that blood test a little bit differently than your cardiologist or your medical doctor. Looking at blood values is another art and a science in of itself. So anyway, looking at blood values, body composition, we shared a few shows ago how you test body fat, for for instance. So we're looking at biometric markers and this should be done by a professional, by the way, who lays out a plan of reconditioning. So if we're deconditioned and we just go join a gym at $40, $50, $60 a month and try to figure this stuff out on our own, it would be kind of like me trying to figure out my financial plan by myself. If I wanted a financial plan, I would get a financial advisor. I would say, well, I'm not someone who's gone to school to understand or put together a financial analysis for myself. So I would go to a professional. If my car breaks down, I bring it to a mechanic. The same is true in this field, but what ends up happening is the misconception that we should go and join a gym. Everybody is different. We're all at different phases and levels of our lives. I'm 47 years old and I train differently than I did when I was 20 years old. Now, the benefits of exercise are, yes, overwhelming. We should all know by now that God designed us to exercise. Our bodily systems benefit from exercising. Our cardiovascular system, our respiratory, our immune system, our musculoskeletal system, digestive, neurological. All of these systems are optimized. We want to optimize our joint, bone, our muscle health, and our strength, our metabolic rate. We talked about that last week, our BMR. We want to burn more calories more efficiently. Doesn't that make sense? Instead of doing calorie restriction, which you would never hear from me, calorie restriction is a big no-no. But we want to make our bodies that were designed by a designer to be more efficient, use up those calories in the right way. We want our body composition ratio of fat to lean tissue to be one that's appropriate for us. So if we're greater than 30% body fat, for instance, that's something that we need a plan to go work on, just like a financial plan. Our cholesterol levels are optimized while we exercise. Blood sugar regulation is optimized. Our mood, our mental attitude, our performance at work and around our homes and as Christians is optimized. So the benefits of exercise should never be overlooked. It should never be understated. We want to improve our overall physical ability, our body's ability to heal and then repair degenerative conditions, our sleep quality, the way we look, our self-confidence, our self-esteem. These are all benefits of exercise. Our energy and our vitality while reducing fatigue, our desire for healthy and lean nutrition plan. Now, the nutrition and exercise typically go together. So we should desire this as God's plan, and it's an excellent stress and tension reducer. So if we're exercising, we're reducing stress and tension. Now, as we're going through the benefits of exercise and we're improving our BMR, we're also increasing our fat-free mass as opposed to our fat mass. Remember, our fat mass is something that we want to keep at a proper ratio to everything else on our body. So as much as our fat mass and the ratio of our fat mass, or the percentage of it, should be measured. That's one of the biometric measurements. We want to make sure that we're also improving fat-free mass, such as our bone density, our muscle quality and quantity. So resistance training or using weights when we get into a reconditioning program is going to improve bone density. It's going to improve your BMR. It's going to improve your glucose tolerance and insulin sensitivity. It raises testosterone and growth hormone, which is a good thing, and it preserves balance, flexibility, and functionality. And what it does, it creates a larger metabolic afterburn than cardiovascular training. And what that means is, if you're doing resistance training, long after you've done your workout, you've improved your BMR to efficiently use those calories better than cardiovascular training. A lot of people don't know that because your metabolic rate is in the muscle. So if we're improving muscle quality and quantity, we're improving our BMR. That's why I get mad at some of my patients who are not using weights. They go to the gym, they run on a treadmill, they cycle. There's nothing wrong with that. But we have to improve the quality and quantity of our muscle mass, and you get that with resistance training. I'm not telling you to go join a gym. Remember, that's what this show is highlighting. We're highlighting to get conditioned, we first have to isolate what are the deconditioning points in our body. We're looking at it, remember, from biometric markers, doing a waist circumference measurement, a body fat measurement, blood testing. We're looking at biometric markers to put together a reconditioning program. When we are in reconditioning, we want to be exercising and doing strength training based upon your specific profile. Not mine, but yours. That's why this needs to be done one-on-one. So cardiac training or aerobic training, that's very beneficial too. It lowers your resting heart rate. That's how many times your heart beats per minute, which is a healthy thing. We want to lower our heart rate. We're going to increase our HDL. That's our good cholesterol. Exercise has been proven to raise HDL and lower LDL. It lowers blood pressure. It also improves and maintains good circulation to the brain, and it aids in detoxification. So cardio training is part of an exercise program or a reconditioning program. Last week we discussed what are any good fitness program should entail: strength, endurance, flexibility, and coordination. So those four components come together in a proper exercise program. So what are the action steps then to get started? Like, what are we going to go do? I always look at Monday morning. All right, Proodian, you spoke to me on Saturday. Sunday was my day off. It was a day of rest. And now it's Monday. Now, hopefully over the last few weeks, you've been using some of the structural integrity discussions we've been having and implementing them into your lives. I've been getting emails about people adjusting their monitors, about adjusting their chairs at work during the ergonomic checklist. I've gotten emails from people who have said, I've gotten my bloods, I've gone through the analysis, I'm looking at my body composition. I don't want to start a reconditioning program yet. We have to do our homework. All right, we have to do our homework. I wouldn't just go to a financial advisor if I didn't bring him my life insurance plans, my 529 plans, and all of the things that a financial advisor would need to put together an action plan for me. Medicine, healthcare is the same way. It should be the same way. It's not one shoe size fits all. So we want to get measurements, body composition. We want to get our inches measured, for instance, our waist circumference. We want to get our bloods measured. We want to set our goals. What are realistic goals for you? What are the goals that we're setting out to do? Are we really setting out to run a marathon? Is that really our goal? All right, so that part of it, many people need help outlining their goals for what part of life they're in. We want to identify whole foods and enjoy them. We want to write them down on a piece of paper. We want to shop for them, and we want to have fun preparing our food. We want to structure our lifestyle around the fact that lifestyle medicine begins with us having a plan. And that plan of action, just like we have a life insurance plan, a financial plan, we all have these planners in our lives. Healthcare has to be done the same way. So we want to be accountable for our actions. We want to address high priority clinical factors. So for instance, if somebody has high cholesterol, high blood pressure, and is pre-diabetic, those are factors that a guy like me is going to take as high priorities. How you look in the mirror is not a high priority if we have those other factors. So we want to create an actual action plan in this reconditioning these reconditioning steps. So what are the obstacles? Here we go. I don't have enough time. I'm always tired. I have to drive to where I need to do this. I don't have enough money. I don't know what to do. and my results are slow. So time, energy, travel, money, lack of knowledge, and slow results are the 6 things that always kick people up, right? What are the 6 things that I always hear in practice? I can't do it. I don't have enough time or energy, money, or, I don't know what to do when I get there. Everybody's in, the spandex pants and they look better than I do, and all of these excuses. And first thing you should do is really consider not going to a gym. The gym is a place not for deconditioned people, particularly many times people who are dealing with pain, abnormal blood values. They really should be seen by a specialist prior to engaging in a reconditioning program. Going to a gym with a plan, now that's a good idea. Actually utilizing a gym with a written plan, that's what we want to do. So we have to identify the fact that if we have low energy and fatigue, we're overweight maybe, not having enough adequate muscle, we have chronic pain, what path are we on? We want to write those things down, we want to get clarity on them, and we want to develop a plan. So what, the current path, ask yourself this, whatever age you're at, where do you see yourself in 5, 10, 15, 20 years? So as we age, the plan of reconditioning, our desire to be reconditioned and to be strong and healthy. We all know, listen, we don't know when tragedy and trauma might strike, and when it does, there's nothing we could do about that. But while we're here, identifying old habits and creating new habits for long-term health gains is essential. So starting a health journal is something that I've always liked and I've always told people to do. Write it down. If you write it down, make it a priority and plan, reconditioning should be part of your life. And reconditioning begins with seeing a specialist who could identify many of the things that we're talking about today. And this is not necessarily a medical doctor. This is somebody who's trained in reconditioning, rehabilitation, nutrition, exercise science, and modalities like that. So we'll end the show today with understanding what biometric markers are, understanding that reconditioning begins with having an action plan, and that action plan requires us to take back our health, to take control of our health, and follows God's plan and not man's plan. And thank you for listening to the By Design radio program, and me, Dr. James Proodian, for this episode. If you'd like more information on me, please go to ProodianHealthcare.com and submit any questions you might have. I want you to have a great, blessed week. And I hope that your summer continues to go well. And really think about Monday morning, starting that health journal, write things down, write those priorities down, and let's make some changes. God bless.